Thank you, Paula, and welcome to everyone who's joining us. The presenters and I were just chatting before this session began about how many more people are attending this session and attending a bike ped session at OTEC because we're online. So we are super excited to have maybe a more broad audience than we normally would to listen to our session. So this session is number 10, Planning for Pedestrians and Bicyclists. And so we have 4 presenters today. Jordan Whisler, Sarah Ginnetti, Carrie McKee, and Kate Harley. And so they each have a separate presentation. And if you have questions as we go along, encourage you to type your questions into the chat box. That will be the only way for us to be able to respond to questions from the audience. So at any point during the presentation, feel free to just go ahead and type in your question, and if you could put who your question is directed towards. We might assume that it's for one person or another, but we might get that wrong. So if you could just let us know who you'd like that question to be answered by, that would be very helpful. So with that, let's get into our first presentation. And so I'm going to hit control over here to Jordan. So Jordan Whisler is our first presenter today. Jordan manages ODOT statewide planning section at ODOT. Before being in the statewide planning section, he spent 2 years in ODOT's Office of Program Management, managing local safety and active transportation programs. Now, before Jordan joined ODOT, he spent 5 years with MORPC, which is the MPO here in Columbus, Ohio. And before that, 2 years with the Ohio State University in transit operations. Jordan is a professional AICP and proud graduate of the Ohio State University, where he earned a master's degree in city and regional planning. In his spare time, Jordan enjoys cycling, traveling, which we can't do a lot of these days, but also cooking. So Jordan, go ahead.
First, can you see my screen, Scott?
Yes, we can see your screen.
Great, you can hear me well. So thanks, Scott, for the introduction. As Scott said, my name is Jordan Whisler, and I manage the statewide planning section within ODOT's Office of Statewide Planning and Research. And I'm so excited to be here today to have the opportunity to discuss Walk Bike Ohio, Ohio's first statewide transportation plan solely focused on the needs and opportunities surrounding pedestrians and bicyclists. As many of you may know, over the last year and a half, ODOT and our consultant teams have been hard at work engaging partners across the state to help better understand the current state of walking and biking within Ohio, to help better understand what Ohioans and partners want to see for the future of active transportation within the state, and to help better understand where there are opportunities that exist to help move that vision for the state forward. So over the next few minutes, I'm going to be providing an overview of that work. I'm going to start by highlighting the state of walking and biking and providing some brief context on how it is we got here. And then I'll move on to discuss the future of walking and biking, or what we know constituents and stakeholders want to see for the state. And then I'll spend the rest of my time detailing out our draft action plan, or what we're proposing that we as an agency focus on in the coming years from a statewide perspective to help ensure a more walkable and bikeable Ohio. So where are we at now as it relates to these modes, or what is that current state of walking and biking within Ohio? Well, in order to understand where we are today, I thought it would be important to understand where we came from. And to do that, I wanted to start from the very, very beginning. So we know that humans haven't always lived within the Ohio region, that in order to get to the Americas, that our ancestors would have likely walked. They would have likely walked across the broad continental shelf connecting Asia and North America, ultimately arriving in Ohio by foot in around 13,000 BC. And those would have been the first Ohioans, or, as I like to think of them, the first pedestrians. And that's because these individuals would have largely relied primarily on walking or on active transportation to meet their daily needs. And for the inhabitants of this region, this would have largely remained the default mode of transportation for thousands and thousands of years. But beginning in the late 1700s, this really began to change, starting with the invention of the horse car, early innovations in surface transportation, including the bicycle in 1817, began to fundamentally change how it is we navigated space and began to usher in new and distinct eras in American history, not only impacting our relationship with space and the built environments, but virtually all aspects of our daily lives. And we can see that play out in early photographs from Ohio. Here's downtown Mansfield in 1890. Fast forward 20 years, and this is downtown Columbus in 1910. 30 years later, downtown Canton in 1940, and downtown Lorain in 1964. And as you likely have noticed from these photos, these innovations combined with significant federal policies and funding have profoundly reshaped and changed both the fabric of our built environment, but as well as our individual travel patterns over the last 200 years. And these changes would have had a profound impact on the lives of Ohioans for good and bad. You know, our quality of life, our economic prosperity, our natural environments, our built environment, and much more. But the thing to remember is that through all of this change and evolution is that there are Ohioans who have consistently relied on active transportation to meet their daily needs. Now, obviously with walking, but with bicycling as well, Ohioans have never stopped, and they will never stop, relying on their own 2 feet and human power to get from point A to point B. But with all of these changes in technology, within policy, within development, came segregated land uses and rapid suburban and new suburban developments and automobile center connectivity throughout large portions of the state. And we know that through both quantitative and qualitative data that these changes have profoundly impacted active transportation users within Ohio and their ability to safely and conveniently navigate the transportation system. So while most urban centers within the state still feature sidewalk networks throughout much of their original development, as suburban development grew outward from those urban centers, sidewalks and bikeways were often not included within that development. And that left the system for pedestrians and bicyclists fragmented and disconnected with many barriers. Additionally, roadways through urban centers have been significantly altered and expanded to accommodate automobile demand from surrounding areas, creating significant connectivity and safety concerns for people on foot and on bike. And we know that just like the rest of the country, that ever since the rapid adoption of automobiles beginning in the early 1900s, that severe traffic crashes between automobiles and non-motorized users have been a major issue for the state of Ohio. And we know that even today, Ohio is not trending in the right direction as it relates to pedestrian and bicycle safety. Between 2009 and 2018 alone, there was a 49% increase in pedestrian fatalities and a 6% increase in bicycle fatalities, with currently around 850 bicycle and pedestrian fatalities or severe injuries occurring on Ohio's roadways every year. And we also know that roadways weren't created equal with respect to safety of non-motorized users, that arterial roadways in particular through both urban and suburban areas represent major safety concerns for pedestrians and bicyclists. 56% of fatal pedestrian crashes and serious injury crashes and 46% of bicycle fatalities and serious injuries occur on arterial roadways, with arterial roadways only making up 8% of the total system. We also see disparities across socio-demographic and socioeconomic groups as it relates to walking and biking, and in particular safety. In Ohio, data indicates that bicycle and pedestrian crashes disproportionately affect people of color. In 2017, 18% of Ohio's population identified as non-white, but accounted for 30% of fatal pedestrian crashes, and over the last 10 years, on average, 21% of bike crashes. We also see discrepancies among gender within bicyclists. The National Household Travel Survey in 2009 found that males biked at a rate of 2.1, compared to their female counterparts. And in a recent survey conducted by OSU, when Ohio women were asked to identify why they don't bike, almost half said safety in nearby traffic was a major barrier. So it's not a surprise that today within Ohio, we're currently ranked 28th out of all of the states in commute mode share rankings, with the combined commute mode share for walking and biking of 2.5, 2.6%. Related to this, we also know, while it's not the sole factor, the decline in active living has also impacted the livability and health outcomes within our state. Currently, Ohio is ranked 47th out of 50 for health behaviors, which include obesity, physical activity, and while only 19% of Ohioans met federal guidelines for physical activity. Admittedly, in providing that brief snapshot of the current state of walking and biking here today, I've chosen to focus on some of the more disheartening realities that we face as a state, because I think they're important not to lose sight of. But with all of that in mind, we can say that there's a lot of reason to believe that the future of walking and biking within Ohio is very bright. We know that there is fantastic work happening all across Ohio within hundreds of organizations, not only to address the issues I've talked about and more, but to capitalize on the opportunities for a more walkable and bikeable future. Throughout the Walk Bike Ohio planning process, we've engaged thousands of individuals and hundreds of professional stakeholders to understand their hopes and dreams and current initiatives and programs and investments and goals, and understand what they want to see for the future. And that has led us towards a collective vision of where it is we're headed as a state, or what the future of walking and biking in Ohio might look like. And when we look forward to the future, we see a future where walking and biking is safe and convenient and accessible as a transportation option for everyone. And that vision is supported by 6 main goal areas: safety, equity, network connectivity, livability, network utilization, and preservation. Diving a little bit deeper into each one of these, we envision a future focused on the safety of all of our users of our transportation system, and one where partners are working diligently to reduce and eliminate the number of bicyclists and pedestrians being seriously injured and killed on Ohio's transportation system. We envision a future focused on equity, ensuring Ohio's transportation system accommodates users of all ages and abilities and income, one where your socioeconomic and demographic status doesn't determine whether or not you are afforded the opportunity to safely and conveniently meet your daily needs. We envision a future with connected and continuous pedestrian and bicycle networks where there are opportunities for all Ohioans in urban, suburban, and rural areas to have access to connected walkways and bikeways. We envision a future where our transportation network isn't a barrier to quality of life, but that transportation network actively facilitates it. We envision a future where pedestrian and bicycle infrastructure is treated and maintained like the critical infrastructure that it is. And we envision a future where walking and biking, regardless of age and ability, that there's opportunities to increase that within your daily life. And that brings us to the action plan, helping answer some of the most important questions of how it is we're going to get there. And to be completely honest, we know that this vision for the future is larger than the Ohio Department of Transportation, that partnerships and focused efforts are needed from all levels of governments and organizations and stakeholders within the state. The following presenters will showcase some of the fantastic work happening within their own organizations to ensure that walking and biking is safe, convenient, and accessible for everyone in the state of Ohio. But with the remainder of my time here today, I'm going to focus on how ODOT plans to help advance this vision and goals. When we look at Walk Bike Ohio as a plan, it's primarily meant to do 2 things. It's meant to help solidify our statewide vision and goals around walking and biking, to help guide long-term walking and biking policies. And the second is to help formalize ODOT's short-term activities and strategic initiatives for the next 5 years, to outline the initiatives that we're going to be focused on programmatically in the near future to help move this vision for the state forward. And these programmatic initiatives really fall into 5 major themes: planning and policy, implementation and funding, education and promotion, data, and collaboration. At this point, I'm going to provide a high-level breakdown of each of these themes and the associated strategies, but just want to say that there is much more detail related to the specific action steps that will be included within the actual draft plan when it's released, and I'll touch on that a little bit later. The first programmatic theme is planning and policy. So our goal here is that ODOT, working with partners, will use planning and policy tools to engage the public, provide design guidance, and ensure active transportation is part of best practices in transportation network development and operations. This includes development and adoption of multimodal planning, design, implementation, and guidance. So a focus here on ensuring that multimodal priorities are clearly defined within ODOT guidance and standards, such as within our project development process, our design manuals, and our planning frameworks. In the short term, we'll also explore opportunities to support bicycle and pedestrian facility maintenance. Maintenance was a major theme that came up throughout the Walk Bike Ohio planning process, and we understand that there is work to be done in ensuring that responsibilities around maintenance are clearly defined and that the preservation of multimodal facilities are prioritized and resourced appropriately at the local and regional levels. We also recognize the importance in the development of clear, consistent, and meaningful evaluation metrics and performance measures. So a commitment to transportation performance management around active transportation and ensuring that active transportation performance measures for the state are established, and ensuring consistent, transparent reporting of the state of walking and biking within Ohio. Our second theme is funding and implementation. We recognize that the implementation of pedestrian and bicycle projects can be incredibly difficult, whether that's retrofits of the existing roadway system or development of new facilities. And that is particularly true for local governments who own and maintain the roadways where pedestrian and bicycle infrastructure is often needed most. But know that ODOT is committed to continuing to provide resources to local partners to overcome burdens and hurdles in project development and funding. Specifically, ODOT will continue to assist local communities in project development and implementation through sustained financial support of locally facing funding programs, such as our MPO and Large City Capital Program, our Highway Safety Improvement Program, our Transportation Alternatives Program, and our Safe Routes to School program. We're also focused on the implementation of the state and U.S. bike route system through Ohio. And Kate Harley will discuss this project more later in this session, but just know that ODOT is committed to working with partners to strengthen a backbone network of bicycling accommodations throughout the state. And lastly, we'll continue to support regional and cross-jurisdictional active transportation project implementation. So working with partners to ensure that network connectivity doesn't end at jurisdictional boundaries. Our third theme is education and promotion. ODOT will work with our partners to use education and promotion tools to educate and inform roadway users, elected officials, and practitioners on bicycling and walking matters. So this includes development of education materials for roadway users on their rights and responsibilities impacting walking and biking, educating elected officials at all levels about the importance of a more walkable and bikeable Ohio, providing technical assistance and education to practitioners, including planners, engineers, law enforcement, and their partners, and promoting walking and biking as a transportation option. Our fourth theme is data. ODOT recognizes that collecting and maintaining quantitative and qualitative multimodal data is critical to ensuring our decision-making processes reflect the full spectrum of mobility within the state. And to that end, we're going to be focused on development of statewide active transportation-related asset inventories, working to establish systematic programmatic activities related to understanding active transportation usage across our system, and working to expand active transportation safety data collection and analysis. And our last programmatic theme is collaboration. As was mentioned, ODOT recognizes that developing and sustaining relationships with partners is critical in moving towards a more safe, convenient, and accessible future for Ohio. And we are committed to engaging state, regional, and local practitioners and advocates to leverage resources and achieve common goals, specifically focusing on strengthening our ongoing coordination and collaboration between ODOT and its local partners, and strengthening collaboration between ODOT and our sister state agencies. So that was a really high-level overview of our draft action plan. We've been so fortunate to have significant engagement throughout the planning process from stakeholders across Ohio, and as a result, we think we've developed an action plan that is responsive to the needs in Ohio today and will position us well as we move into the future. But as we look to solidify this plan by the end of the year, we're asking for your help. In the coming months, we will be putting out a draft plan for public comment, and we ask that you take this opportunity to review and let us know what you think. So be on the lookout for this draft plan release in the next few months, and would encourage you to visit our project website if you're interested in learning more and staying up to date on this work. So with that, I want to thank everyone for their time here today, as well as all of the past engagement and future engagement, not only in the development of Walk Bike Ohio, but in the development of a more multimodal Ohio. Please don't hesitate to reach out to Andrew Shepler, ODOT's Walk Bike Ohio project manager, Kate Harley, or myself with any questions or comments that you may have. Thank you.
All right, thank you, Jordan. Appreciate that. You said that you practiced it and you were at 19 minutes and you pretty much hit that spot on. We did get one question, Jordan, and this comes from Bob Jessberger. And just to kind of maybe elaborate on his question a little bit. So in our cities today, we see a lot of these e-scooters. People pick them up at downtown or near major universities and ride them. And as we try to plan for these sorts of things, what do we consider those e-scooters? Are they PEDs? Because you're standing, you just step off of it and you're there. It's not like a bicycle, or is it more like a bicycle because it has two wheels? So as we try to do counts and things like that, what do we consider these e-scooters?
Yeah, that's a great question, Bob. And first, I would just recommend that you check out the Walk Bike Ohio website. One of the things that we did as part of this planning efforts and looking at existing conditions is looking at this new mobility. So there is a long, detailed report on our website that will go into some of the specifics around these new mobility modes and what that means for us as practitioners. But to dive a little bit deeper into your question, I think that this is an evolving conversation and topic. Are we designing bike lanes anymore? Are we designing low impact facilities that could get used by vehicles such as scooters and bicyclists that have similar speed differentials and characteristics, or how do we classify these types of vehicles within things like even our crash data or other mode data such as volume? And I think these are very relevant questions. It's something that we looked at quite deeply as part of this effort, and would encourage you to check out our website for a little bit more information on that.
Great, thank you, Jordan. We did get a couple more questions, one from Michael Leggett and one from Letty Shemp, but we'll probably have to save those till the end because we're going to move on to our next presentation right now. So our next presenter is Sarah Ginnetti. Sarah is the program manager for the Ohio Department of Health's Creative Healthy Communities program. In her role, she oversees 23 local health departments who are receiving grant funds to implement healthy eating or active living policy systems and environmental changes. Now, some examples of this would be farmers markets, community gardens, complete street policies, and active transportation plans. Sarah has 8 years public health experience. She's a registered and licensed dietitian in the state of Ohio. And she lives in Bexley with her husband, Justin, who's a civil engineer for the city of Columbus, and her daughter, Gianna. So Sarah, thank you for presenting today.
Thanks, Scott. Good morning, everyone. As Scott mentioned, my name is Sarah Ginnetti, and I manage the Creating Healthy Communities program at the Ohio Department of Health. And before I start my presentation, I just want to acknowledge tool design, as well as my colleague Ryan Ballrath, who helped make the Ohio Action Institute and this presentation possible. So first, I'd like to give you a brief background about the CHC program. Our vision is making the healthy choice the easy choice. We are committed to preventing and reducing chronic disease statewide. Through cross-sector collaboration, we are activating communities to improve access to and affordability of healthy food and increase opportunities for physical activity where Ohioans live, work, and play. By implementing sustainable evidence-based strategies, CHC is creating a culture of health. We are also committed to equity, and we believe that health equity is achieved when all people in a community have access to affordable, inclusive, and quality infrastructure, and despite historical and contemporary injustices, allow them to reach their full health potential. CHC funds 23 local health departments across the state for a 5-year grant cycle. We are currently in year 1 of 5 for our 2020 to 2024 grant cycle. Each county is required to have a full-time coordinator working on the CHC grant, as well as a coalition that is representative of their priority population. Our program is funded from the Centers for Disease Control and Prevention through two funding sources, the Preventive Health and Health Services Block Grant and the State Physical Activity and Nutrition Grant. At ODH, we manage these federal funds, select grantees, and provide technical assistance in addition to monitoring and evaluating the program. 23 local health departments are funded through a competitive grant on a 5-year cycle. Counties are selected according to health outcomes and disparities, as well as local efforts. Local health departments then hire CHC coordinators to manage the program locally and work with 3 priority communities, coordinate local coalitions, and create and implement action plans. In addition, we also contract with Tool Design to provide technical assistance, training, and resources related to active transportation. So now that you know a little bit about CHC, you might be wondering why public health is presenting at OTEC. As mentioned previously, much of our work is funded by the CDC. In 2018, CDC launched a new initiative called Active People Healthy Nation with the goal of 27 million people meeting the physical activity guidelines for Americans through an approach called creating activity-friendly routes through everyday destinations. And the way CHC fits into this goal is our coordinators work on strategies like complete streets policies, active transportation planning, and land use interventions with their coalitions and partners. So the 2018 Physical Activity Guidelines for Americans do vary based on age group. For children, this means 60 minutes of physical activity a day, and for adults, 150 minutes each week. These minutes can be broken down into small increments each day, such as a 10-minute walk or 30-minute bike ride several times a week. Unfortunately, Ohio's adult physical activity rates are consistently below the national average. While physical activity numbers among children are better than the national average, the number of children who are physically active at least 60 minutes a day is very low. Physical inactivity can lead to the following health effects, such as obesity, diabetes, hypertension, heart disease, and some cancers. It's important to note that clinical care only attributes to 20% of health factors, so we need to focus on policy systems and the physical environment to help influence health behaviors and ultimately health outcomes. And this is where CHC's work on active transportation comes in. The Creating Healthy Communities program advocates for changes in the built environment that make it easier for Ohioans to get their recommended amount of daily physical activity. This involves making it easier for people to walk, bike, and play in their own neighborhoods through changes to policy systems and the built environment. Active transportation includes all ways of getting around that don't involve motorized single occupancy vehicles. And this can include walking, biking, using a wheelchair, electric scooters, skateboards, horses and buggies, and also using transit. It also focuses on these modes as transportation and not just for recreation. Obviously, there are many benefits to walking and biking. Overall, there is a significant 12% reduction in mortality associated with active transportation, and there is an 11% reduction in risk of cardiovascular disease associated with active transportation. And studies show that people who live in walkable communities are twice as likely to achieve the CDC's recommended level of physical activity as those who do not live in walkable communities. Most of us know the importance of being physically active each day and would like to walk and bike more in our communities, but unfortunately in many parts of Ohio, it is unsafe to do so, or there are barriers to getting from point A to point B without the use of a single occupancy vehicle. Many of our funded CHC communities know they want to promote active transportation, and creating a plan is a great place to start. Because active transportation planning takes many partners, and CHC coordinators are skilled at building partnerships and creating coalitions, an Action Institute is a great way to bring together teams to jumpstart local efforts by providing technical expertise and assistance while ensuring that local leaders still have ownership over their plans. The first Ohio Action Institute was held in 2017 and involved the other panelists on the call today, and has led to the formation of multidisciplinary teams that are still active to this day and leading important transportation work in their communities. In the center photo there is our CHC coordinator in Perry County, Jenny LaRue. Her and her team participated 3 years ago, and they are still going strong with their work. So due to the success of the Ohio Action Institute in 2017, we wanted to replicate this experience this year in order to assist our CHC communities working on active transportation, as well as fulfill grant requirements set by the CDC. The goal is to have teams learn about active transportation, receive training and technical assistance from local and state and national experts, and ultimately develop a recommended active transportation network and action plan for their community. This effort was coordinated by ODH as well as ODOT and Tool Design. Out of the 8 teams of our 23 counties who chose to apply, we were able to select 4 in Huron, Licking, Ross, and Trumbull counties. The city and jurisdictions that worked on the plans are in parentheses there. So this image on the slide depicts the number of organizations involved in the Action Institute. We used our state physical activity and nutrition funding to support the Action Institute, and Tool Design organized and led this multi-day workshop. Each team was led by the CHC coordinator, included other members from the community, such as planners, engineers, and local government officials. Each team received technical assistance from an advisor at Tool Design throughout the entire process. Prior to the Action Institute, each team was required to complete several assignments. First, they created base maps, including local data layers such as sidewalks, existing bicycle facilities, and transit routes. Teams also did research to understand how existing plans, policies, or codes could be used to improve active transportation. Of course, as with the rest of the world, we had to pivot due to COVID-19. The Institute was originally envisioned as an in-person experience with two workshops, one in May and August, but we had to shift to an all-online format. So we chose to do everything all virtual via Zoom, and rather than having 2 full days in May and August, we spread this out over 3 to 4 days to limit the amount of Zoom meetings that each team had to participate in each day. And the community engagement that I'll talk a little bit about that happened between the 2 workshops also had to move mostly virtual, which was planned in person originally. The first workshop covered how to analyze existing conditions for active transportation and how to effectively engage communities. Teams developed a draft active transportation network, engagement messaging, and an action plan for the summer. Each team received resources and tools to conduct community engagement, to gather feedback on the draft network, primarily through an online interactive map. As you can see here, we had breakout groups, meetings by counties, as well as general sessions spanned throughout the course of 4 days. Some sessions were educational to teach teams specific concepts, while others were working breakout sessions for each team to apply what they learned. Presentations were delivered from staff from Tool Design, as well as other experts in the field. In between workshop 1 and 2, each team was tasked with gathering input from community members on their active transportation network maps. They asked survey questions around why and where people walk and bike in their communities and areas where they would like to see improvements. In addition to the survey, each team had an online wiki map that community members could provide feedback on. And in the next presentation today, our CHC coordinator from Licking County, Carrie and McKee, will go into more detail as to how a lot of this was done at the local level. After the summer community engagement was complete, each team finalized their active transportation network map and finished developing an action plan for implementation during workshop number 2. Informational sessions during workshop 2 included how to measure performance, a session on street demonstration projects, and also the focus on equity. Despite all of the changes in the plans to run this Action Institute because of COVID, we are very pleased with the results of the Action Institute this year. The 4 teams collected total 490 resident surveys, and 420 comments on the draft network map from community members, which inform the final recommendations contained within their active transportation plans. The potential improvements identified by the plans included 46 miles of sidewalk, 103 miles of on-street bikeway, 123 miles of shared use path, and 80 spot improvements, such as crosswalks. 100% of participants gained insight about developing an active transportation plan. 94% of participants said they were satisfied with their draft active transportation memo. And I won't read them all, but there's some testimonials here as to how the participants felt that the workshop went. I'll read the first one in blue. This process gave us a template and the AT knowledge of how to go about completing an AT plan. Without this workshop, we would have been challenged in where to begin with the plan's development. So finally, what's next? Each of the 4 teams are bringing these plans to their local governing bodies for adoption, and will work towards implementing those recommendations over the course of the next 5+ years. Each of our teams have a Creating Healthy Communities grant through 2024, and we will be assisting them in implementing those plans throughout these next 5 years. We're also planning for another Action Institute in 2021. And that's all I have. This is my contact information, and I'm happy to answer any questions now, or feel free to email me or call me after today's session. Thank you.
Thank you, Sarah. So we will probably hold questions for you till the end. So thank you for your presentation. So Sarah just presented to us on the Ohio Action Institute, and she provided a statewide perspective from the Department of Health. Our next presenter is going to be Carrie McKee, and she works with the Licking County Health Department. And so Carrie is going to give us a perspective of the same process of going through this Ohio Action Institute, except from the local perspective. And so, as I said, Carrie works with the Licking County Health Department, and there she coordinates the Creating Healthy Communities grants. In this capacity, she works on chronic disease prevention through policy, system, and environmental changes to make the healthy choice the easy choice. Carrie's worked with local transportation partners on bike infrastructure, multi-use trails, and active transportation planning over the last 2 years to create more active living opportunities in Licking County. Carrie is a certified public health specialist. She holds a Bachelor of Science degree in health promotion and a Master's of Public Health. When she's not working, Carrie enjoys spending time with her husband and her daughter. So, Carrie, thank you for presenting today. All right, I think you might be on mute there.
There we go. Can everyone see my screen?
Hear you now.
Okay, perfect. All right, so I'm Carrie McKee, like you said, and I'm going to talk about kind of our perspective from the local level working on our active transportation plan through the Ohio Action Institute this year. And okay. So one of the reasons we decided to work on active transportation in Licking County this year is that we've started to develop really strong partnerships, and that has just provided us lots of opportunity for collaboration with our local planners and engineers. We've been working on different CHC active living strategies over the last 2 or 3 years. We've worked on our multi-use trail network. We've put in covered bike parking, and we've worked on some pedestrian infrastructure improvements. And so all of those little projects have kind of helped us build these partnerships that we would need for bigger projects like active transportation planning. The timing was really good this year, again, just because of all those mini projects that we've been working on, but also our local MPOs were ready to update the active transportation plan for Licking County. And they came to us at the end of last year, and then we heard about the Action Institute, and so it was just a great opportunity. In Licking County, we have very limited public transit. We have an on-demand service, so you have to call ahead. It has to be scheduled in advance. It's not something where you can decide that you need to run to the grocery store or run out to a doctor's appointment and be able to find a ride quickly. Newark is the county seat of Licking County. As you can see, the photo there is the new town square, revitalization and some of the nice roundabouts and pedestrian infrastructure that they've put in. So they are just on board and ready to continue this work outside of the main downtown square. As Sarah has talked about, health is a major part of active transportation for us and kind of where the public health perspective comes into play. It's been good to bring the health perspective to planning and engineering and be able to kind of mesh our knowledge together. I've learned a lot from them, and I think and hope that they learn a lot from me when we get together and we're able to come together and find a common goal and work on those things. So they achieve things in the active or in the transportation world. I achieve things in the health world, but really it's one goal that we're working towards. And we chose to work in the cities of Newark and Heath. They border each other, and they're really what we would consider our urban hub in the county. You're going to find a lot of social services, the courthouse, admin and government buildings in Newark, and Heath has a lot of shopping and different businesses. We built our team for the Action Institute. We wanted to make sure that we had a lot of different representation from multiple sectors. So we had myself as the CHC coordinator and another public health educator here at the health department. We had GIS coordinators, our local MPOs and planners, city transportation engineer, building and zoning, and ODOT. And all these different perspectives really helped make our team successful. Our planners and engineers just had a better lay of the land, and our city engineer in Newark just really knew all the intricate details of streets and upcoming projects and things that would work and probably wouldn't work. And so that was just really invaluable to making sure that we built something that was going to have the potential that we wanted it to have in the future. We had several challenges and strengths for bringing active transportation to Licking County. Some challenges that we have is poverty is a big issue in the city of Newark. The poverty rate is 20.5% there. And there's, again, a lack of transportation. So many of the households in Newark lack transportation and connectivity to get to everyday destinations. 7% of households in Licking County lack transportation or don't have a vehicle in the home, with 60% of those being in Newark, just to kind of give a little perspective there. So you'll often see people biking or walking in different areas of Newark, not always safely. Another challenge is the lack of connectivity between cities and villages. We have, bike system trails and things like that, but again, sometimes there's gaps in there where you can't get from one to the other or lack in sidewalks. Access to healthy foods is a challenge from a public health perspective. There's no grocery store in our downtown Newark area. Again, with a lot of people living in poverty or in low income areas, that's a challenge for them and a disparity that they have to deal with. They're kind of limited to their options and forced to shop at gas stations or corner stores where things are overpriced and healthy fresh foods are not available to them. And to get to a grocery store, it's several miles away. So it's not a way where they can just walk to it or even hop on a bike and be able to get to a full service grocery store safely. Just updating our planning and our ATP again, those were things that needed to be done so that when reconstruction was happening or new projects were developing, active transportation would begin to get integrated into those projects. Some strengths that we have is our bike trail network. We have over 40 miles of paved bike trails in Licking County. However, there again are gaps and barriers in the trail network that we are working on yearly to try and figure out ways to build those connections. A strength is the close proximity between communities. So while they do lack the connectivity, there is potential for those connections to happen because they are close together, specifically Newark and Heath. Newark's support for revitalization and development in active transportation, our strong partnerships, and then again, just we were ready to update the ATP for the county. So when we went into workshop 1, as Sarah had kind of listed all the prep work that we had to do, it was pretty heavy in the beginning on top of applying for the Action Institute, but it really paid off for us to do all that prep work. We had our GIS coordinators working on the base maps with the local data layers, and then our team kind of split up the existing plans research portion and worked on assessing different policies and plans, looking at different infrastructure that was existing, and being ready to review that when we went into the workshop. And so one of the first breakout sessions that we had was our mapping exercise, and we broke off into our individual counties with our tool design representatives, and they kind of just guided us through taking all of that beginning information and putting it into our wiki map and just highlighting what was current. And that was really helpful. And then another breakout session was our community engagement piece, and just really working through that on different ways to craft messages for different types of audiences. So for example, in Licking County, we know we have a lot of recreational riders who are really experienced at riding their bikes, and they will enjoy our bike trails. Some of them are comfortable riding on some of the rural roadways that we have and some of the bike lanes that do exist in Newark. But then we also have folks who don't really understand road riding. They may be inexperienced with the laws and the safety of riding their bikes, and we often will see them kind of going through downtown not safely, and it's, you know, can be very concerning, and trying to really know that, or knowing that we need to educate them to be able to do that safely, especially when that is their mode of transportation. And so we ended our workshop with a drafted network in our map and just a solid plan to conduct our community engagement over the summer. Out of that first workshop, we developed 3 goals. So our first goal was educating the community on the importance of active transportation for health, equity, and our environment. So we want to make sure that our community understands that when construction is happening for new, you know, pedestrian infrastructure, or new bike lanes are going in, or we're adding trail connections, that, you know, it's not just investment, it's not just you know, tax dollars going towards these projects, that there's long-term outcomes with these. So improving health, improving equity by giving people more mobility options. And then, you know, that also plays into the economy. So if you have a more walkable or bikeable community, people tend to go to local businesses more because they become more accessible. And then for our environment, so we wanted to make sure that education was a big piece of that. Our second goal was to make the community safer and more accessible for walking, cycling, and other forms of active mobility. And the third goal, to create a new network connection, new network connections that bridge the active transportation infrastructure gaps and enable reaching everyday destinations. So here is our existing conditions wiki map. You can kind of see there, the green is our bike trail network. The red and orange dots indicate crashes for pedestrians and cyclists, kind of showing some high spot areas. And then here shows some gaps and barriers in the network. So the orange showing where we need to build in more connectivity. And then those shaded blue areas are areas of interest where people need to get to, and where we need to make sure that people have the ability to connect into those. So our community engagement, this had to be adapted due to COVID, of course. So we used that afternoon in the workshop to work through a really great tool that they gave us, this document that just guided us step by step to really form a strong community engagement plan. We identified our goals and key messages there. We designated our tasks to our team members, and to keep us on track and up with each other's progress, we just set weekly team calls. And I think this just really set us up well. It was really organized and easy to follow what was planned, what we needed to do, and who needed to do what by when. Everything did have to go virtual. I will say that, you know, getting community engagement and being limited to only virtual means was a challenge. It would have been nice to be able to set up at different summer events. We've done surveys at farmers markets before, and just being able to talk to people and kind of hear back from them what they think about transportation and walking and biking in their communities. But we did work on virtual plans and how we would still collect community feedback. And so our outreach plan consisted of social media posts. Those were boosted and paid for with CHC funds. Tool Design created a nice little ad for us with a little video that we could put up to encourage people to fill out the wiki map. LCATS, our Licking County Area Transportation Study, they purchased these yard signs with the QR code. We've used those before for surveys where you know, people always have their phones, so it's a great way to have people just scan that and they can complete a Survey Monkey right there on their own phone, or you can print them off on little pieces of paper and hand them out to people to take later. Obviously, we couldn't hand them to people, but we did do yard signs, and we had them at a lot of the trailheads and some spots downtown in the city areas where pedestrians would be at. So people could just scan that and go in and take our survey. LCAT set a web page up on their website specifically for our ATP with education and information about active transportation, and now houses the active transportation plan that we were able to develop. So this is the wiki map that people would complete when they logged in. They would complete a short survey first, kind of asking them questions about what makes it easier to walk and bike or what makes it difficult. And then they could go in and kind of agree or disagree with the proposals that we made. Overall, we received 150 total responses with 133 total map comments. Most of what people said or suggested agreed and echoed with what we had proposed. Many people wanted gaps and barriers filled in, wanted to be able to get to everyday destinations. So it turned out really well, and it seemed like our amount of responses aligned well with the other 3 counties in the Action Institute. And then we went into workshop 2, which really focused on implementation and thinking about what are we going to do with this plan after the workshop and where is this going to go next. So a lot of the discussion was on funding opportunities, different grants that we could apply for, and different funding strategies. And then we had a final review of our network and kind of prioritizing those projects of what would be most feasible in like short-term to long-term timelines. We looked at some non-infrastructure things. So what are some ways that we're educating on bike safety in the community, for example? And then we talked about demonstration projects and performance measures. So how are we going to gauge if this is successful in the future, and different ways that we would do that. In the end, our proposed projects resulted in 21.43 miles of proposed sidewalk, 11.82 miles of proposed on-street bikeway, 44 miles of proposed shared use path, and 20 proposed spot improvements, like crossings. So you can see here, these are some of the problem areas that we have in Newark. This is on 21st Street, which is not quite downtown, but is where the grocery stores would be and some doctor's offices. You can see in the picture to the left, there's the truncated dome there leading people directly into the middle of the road. And some of our crosswalks across 21st Street aren't like highly visible. So as you can see in these photos, 21st Street is not very wide. There isn't room to ride a bike or a scooter for that matter, however we see it. So again, it's concerning. There's only sidewalk on one side of the street, but as a driver, you're not really thinking about pedestrians because of the way the road is and just the lack of, you know, high visibility crosswalks. And then you can see there's this desire path that's kind of developed, and this would lead, if you cross the bridge, it leads over to the Kroger. So we see that people are needing to get there, and they have made their own walkway. Implementation. So from here, we're going to look at where we can get more funding, different ways that we can apply. In the ATP, there is a matrix of funding strategies. and ways that CHC can contribute funds over the next 4 years, prioritization factors. So we kind of set, kind of our low-hanging fruit projects, things that we can get done relatively quickly at lower costs, some mid-range projects, next like 5 to 10 years, and then some long-term projects that are going to be more expensive and more time-consuming, but really will create the full connected network that we want to see. Maintaining your active transportation infrastructure is essential to ensure that it is achieving the goals that you had set it in place for. And then making sure that we're going back and kind of reviewing what we've done and making sure that it's still effective. So doing things like pedestrian counts, or doing surveys with the community to see how they like biking on our trail networks, things like that. We have all of that outlined in our active transportation plan. Demonstration projects are another thing that we plan to do next year to allow the community and partners to test out some of the ideas that we put into the plan. So setting up a bike lane, curb cutouts, traffic calming circles are things that we plan to do next year in specific communities. Demonstration projects have a lot of benefits. They bring people together. So hopefully next year there won't be COVID and we can maybe have in-person community engagement strategies happening, and we'll be able to talk to people and get their perspective on what they would like to see happen in their community to get them connected and access to more destinations in their area. So it will also, give us the potential to do something that's temporary, but the potential for permanent infrastructure changes. So you can make those adjustments after getting feedback and letting people test it out before you spend all the money and putting something permanent in. Right now we're in the phase of presenting our plan. So the LCAT's board was the ones that were officially adopting the plan, and that approval should be done in November. And then Newark and Heath councils presented for endorsing the plan, and then our final product will be available on the LCAT's webpage that they've set up, and we'll update that as appropriate. So our next steps include using this active transportation plan as a model for other communities in our county, kind of following the same steps. I think, working with Tool and doing the Action Institute really just kept our momentum going. We had, boxes to check off, assignments were due, we had deadlines and timelines, and it was just made it so much easier to keep on track and not have any major dips in our plan and get it done. So I think following something very similar with other communities would be beneficial, and we already have started moving into other jurisdictions and working on plans this year already. Conducting demonstration projects, as I mentioned before, aligning these projects with work with CHC. So each year we create a new work plan, and within that work plan we have 3 active living strategies, and so it's great if we can build off of work that we've done in previous years. So my plan would be to build off of things from the ATP that I can help with, like crosswalks or bike lanes, things like that, and then looking for funding to be able to pay for these projects. And that is all I have. If there are any questions, I will answer them at the end.
Thanks, Carrie. Actually, we got several questions, but I want to make sure that we save enough time here for Kate. So if it's okay, we'll save questions on your presentation until the end. And so with that, we're going to actually move on to hear from Kate Harley. So Kate's going to be presenting on the development of Ohio's strategic bike network. Now, Kate is with ODOT, and she is with our Safe Routes to School program. In addition, she coordinates a lot of our active transportation initiatives, projects, priorities, and many of the programs across our agency. She's been with ODOT since 2018 and has been heavily involved in the development of Walk Bike Ohio that Jordan talked about, the development of our strategic highway safety plan, as well as the implementation of our state and U.S. bike system, which she's going to be presenting here on shortly. In addition, Kate also helped to coordinate and contribute on the Action Institute that you just heard about from Sarah and Carrie. And prior to coming to ODOT, Kate was a planner with the Department of Health, and she supported a lot of the health departments that helped to build capacity around active transportation planning, policy, and programming. Now, Kate is very passionate about this nexus of health and mobility and working to advance transportation options, but she has promised, and she wasn't crossing her fingers, she promised she would keep it to 20 minutes. So with that, Kate, go ahead and present.
Awesome. All right. Hi, everyone. As Scott said, my name is Kate Harley. And, just as many of our local and regional areas in Ohio are working to identify and improve their active transportation networks, like we just heard about from Carrie, ODOT is taking a similar approach through the planning and implementation of a strategic bike network for the state. So that's what I'm here to talk about today. And earlier in the presentation, Jordan spoke about the state of walking and biking, as well as several of the strategies that ODOT is committed to advancing. And so I'm going to talk specifically about the state US bike route system and how it's an effort to really move the needle on goals related to connectivity, goals related to safety, and also share some of the recent data collection efforts that will help to inform future investments to really ensure that our state has a backbone system for biking across Ohio. And if you're interested in hearing a little bit more in depth about what ODOT's doing to make improvements along this network, more from an engineering and project development perspective, I really encourage you to tune in tomorrow for the Designing Safer and Better Bike Ped Facilities session at 10 a.m. to hear Tommy Arnold from ODOT District 8 kind of discuss the so what now and talk about and provide some project examples for improving this network and other projects in Southwest Ohio. Okay, so as I just mentioned, the goal of this network is really to establish statewide connections that are going to provide people biking with safe and convenient connections across the state between population centers and destinations in Ohio. And as we think about the importance of this for connectivity and for safety, I just wanted to sort of touch on really the why behind creating this strategic network, what it means for people, for road users, for communities. From the road user perspective, we know that working to improve accommodations across this network is really tied into improving safety and comfort. There's also the opportunity to increase awareness through signage to really help alert motorists to expect people biking along these corridors where we see people traveling by bike, and just to help to alert people to that. And from a wayfinding perspective as well, to some extent to help identify a course of travel for people biking across Ohio. From a community planning perspective, we also think that having a backbone system across the state is important to know from a planning perspective as well. It can help to inform the development of local and regional bike networks and help us, connect into one another, make sure that these bike networks all connect into each other. And from the statewide perspective as well, this strategic network can also really help to inform investments to make sure that we are incorporating bicycle facilities along priority routes. And beyond that as well, we know that there are a lot of benefits for communities from an economic development perspective. We know nationally and in Ohio that things like bike tourism can contribute to the economy, support jobs, and produce retail sales as well. And as we talk about this, state and US bike route system, I think it's really important to talk about safety. And I just wanted to share a couple of the bike-related safety trends that we're seeing in the state, because at its core, the goal of this system is really to improve safety and make sure that there are connections that support the safe movement of people biking, and beyond, making sure that these segments are safe for people biking, we see so many safety benefits for many road users when we incorporate safer facilities for people biking. So one of the things I wanted to share is just the #1 fatal crash type that we see across Ohio over the past several years. So this is depicting failure to detect, and it's when a motorist is overtaking a bicycle, fails to detect them on the roadway and collides with them from the back. And we see this in the vast majority of situations occurring along our roadways with no accommodations for people biking. And what I mean by that is there's no bike lane, there's no paved shoulder or any sort of parallel path of travel. And 67% of the time we're seeing this #1 crash type in our rural communities or in rural settings within Ohio. And so as we look to develop a statewide network and work to ensure that we're providing a certain level of accommodation for people biking, this will help us to move the needle on this #1 fatal crash type, which we're seeing across the state and also in our rural areas. When we look at our urban and rural areas, we do see that in general, bike crashes are more prevalent in our urban areas, and our severe bicycle crashes, about 80% of them are in our urban settings. But as we start to really drill down to where our fatal bicycle crashes are happening, this spread starts to become more split between our urban areas and our more rural and suburban settings more equally. And one of the other trends that we're seeing from as we look at our severe bicycle crashes is that they're most common in our summer months. So as we head into better weather, we see perhaps an uptick in people biking for transportation or, for recreation and exercise in the summer, or even people traveling, for bike tourism and going on trips. So all of these people that the system would, potentially serve and provide those improved accommodations for. So I want to talk just briefly about sort of the background in terms of planning these routes. I think it's good to know that the development of our strategic bike network really builds off of several previous efforts that have been really critical. One of those is the development of this national corridor plan, the U.S. Bike Route System, which was developed by AASHTO in the 1980s, and of which 5 bike corridors are identified through Ohio. And then the other one is really building off of the, extensive trail networks that we have in the state, thanks to the work of so many local communities, regional agencies, regional planning organizations, parks districts, metro parks, across the state. And as we were developing a strategic bike network for Ohio, it was super critical to align as much as we could with these networks so that we could move towards creating a system that would be connected and as safe as we could make it. And you'll see that these trails are really largely integrated within the U.S. bike routes that were developed for the state. But you'll also notice that there are a lot of gaps, and this doesn't provide really full coverage and connectivity for Ohio. So the integration of our state bike routes really adds more completion to this system. It ensures that we are connecting 76 of Ohio's 88 counties, and this also connects the 17 largest population centers in Ohio and several of our key destinations. And as these routes were selected and identified, beyond looking at attributes related to speed and volume and facilities, as well as balancing things like continuity and connectivity between these population centers. A lot of partners and staff from across the state were involved in workshops and working with partners and doing realignments that made sense, and in some cases even writing and vetting certain routes. So what we have today, this is pulled directly from our transportation information management system. This is the kind of the full network as it looks today, which can be accessed through TIMS. And then I also want to just talk kind of through the short, medium, and long-term steps of this project. We've spent a lot of time over the last few years collecting resolutions of support from communities and agencies across Ohio. This is really important to us as an agency because we know that advancing this network, improving accommodations across this system, is going to involve a lot of partners, and we also know that the state and U.S. bike route system is made up of such a variety of facilities that are owned and maintained by many different partners. So partners including ODOT, including counties and townships, cities, metro parks, and other trail owners as well. So these are really critical partners, partners that are also working on their own local and regional bike networks as well. And as we complete the resolution collection process, we're really in the home stretch of and submit for formal designation next year. We'll also start to work to develop signage, which again will help to increase awareness across the system, starting with our US bike routes. And this is an example of US Bike Route 50, which is fully signed across the state. And then most importantly is thinking through opportunities where we can improve accommodations so that this network truly serves as a transportation system and provides accommodations for people biking. And there's been a lot of work to collect data over the last couple years. What you're looking at on the screen shows all of the facility types across every segment of our state and US bike route system. So again, made up of a variety of facilities. And we can tell you today that as we look across these facilities, about 66% of the system is made up of shared lanes. So these are just roadways where people might be biking. They don't have any specific facility. They're just shared lanes. And then there's some other small percentages of these other facilities. And then about 27% of the current system is made up of shared use paths. Again, really aligning with some of those flagship trail systems that we have in the state, things like the Ohio to Erie Trail, the Little Miami Scenic Trail, the Towpath Trail, just as an example. And having facility data provides a lot of different opportunities for understanding this system, understanding potential gaps or areas where improvements are needed. And specifically, it also enabled us to apply a level of traffic stress analysis to the state and US bike route system. So really, this is helping us to understand how comfortable is it for people to be biking along these segments. And this type of information is going to be so helpful as we think about prioritizing improvements in the future. And these level of traffic stress scores are going to be included into the TIMS map viewer, which I've talked a little bit about and I'll mention at the end as well. So this information will be accessible just as the facility data is accessible as well. And when we think about level of traffic stress, we're really thinking about the different types of users that might be using pieces and parts of this system, who this segments might be comfortable for, and just gives us an understanding of how this system is supporting people who are biking. And what we can tell you today is that 44% of the state and US bike route system currently is comfortable for kind of the mainstream adult population. And really that means it's made up of level of traffic stress 1, so most comfortable, things like our shared use paths, but also potentially some of our really low speed, low volume roadways, as well as LTS score 2. And then as we head into LTS score 3, these are segments that may still be comfortable for some of those more enthusiastic, more comfortable riders, perhaps some of those folks who you might see traveling some of those longer distances. But as we move into level of traffic stress 4 and above, these are areas where improved accommodations are needed in order for this network to really provide that safety and connectivity that we want it to. So again, this data will be integrated into TIMS. pretty soon. And what this looks like online, and this is going to be a tool for us at ODOT to use, is also available for local and regional agencies as well. But all of this is getting integrated within our active transportation map viewer, and it's just a great place to go to be able to quickly look at some of this information. This is just an example of showing you the facility types layer turned on, and then some of the analysis that's coming out of Walk Bike Ohio related to understanding active transportation demand and active transportation need are other types of data sets that can be turned on, along with things like safety. So looking at where crashes have occurred over the past few years, these are all just different layers of information that can help us make project decisions, investment decisions. And again, tomorrow, Tommy's going to talk a little bit about, using different types of data to help inform projects that ODOT's been working on or has been working on with partners. He's going to talk about different ways that projects have been funded. When we look to some of the programs that provide funding for standalone bicycle projects, these are some of the biggest programs. Our Highway Safety Improvement Program, the funding that's traveling through our MPO program, Safe Routes to School, perhaps if there's school connectivity, as well as funding through ODNR, which their Clean Ohio Trails Fund and Recreational Trails Program certainly provides a lot of funding for those regionally significant trails and so on. So there is more information. We do have a web page dedicated to the State US Bike Route System, which you can find if you navigate to bike.ohio.gov and click on active transportation. So this is just kind of gives you some quick resources, particularly our overview and implementation guide, which is a lot of the information I've talked about today. It's really provides the who, what, when, where, and why of this project, and can help just connect you to some other resources as well. So that's what I have for you today. Just know that this is something that ODOT is working on to improve, to make sure that Ohio has really a backbone system that can accommodate people biking across the state. And we'll continue to work on this and continue to work with partners in Ohio to advance safety and connectivity.
Great, thank you, Kate. Appreciate that. And so that concludes the presentations, but we have had a number of questions come in, and so if I could maybe here pass around some questions to our different presenters. First one I was going to give is to Jordan. So Jordan, I'm not sure if you're able to join with us here still.
Yep.
Great. So we had a question come in about Walk Bike Ohio, and is the document going to say anything about local jurisdictions and how they're limited in setting appropriate speed limits that would increase transportation safety for all users? So do we really talk about local legislation and what they can do?
Yeah, that's a great question, and I will also defer this probably to Kate, after I sort of provide some comment on this. But between Walk Bike Ohio, which is our statewide transportation plan that we're developing around walking and biking, as well as the Strategic Highway Safety Plan, which is this federally required plan that we complete an update on every 5 years. There's a lot of content around speed and some of the implications on that. I think that whoever asked that question is likely pointing to some very valid limitations within the current methods used to set speeds, not only within Ohio, but across the country as well. And these methods have been codified within the ORC, really around concepts related to things like the 85th percentile. And we recognize that method doesn't necessarily provide as much context sensitive speed limit setting that is sometimes necessary. It doesn't take into account things like presence of bicyclists or pedestrians, for example. So there's two things that ODOT is really focused on there. One is really trying to understand where there's flexibility within that current process to provide more discretion on how that gets set and the factors that we look at. in regards to establishing context sensitive as well as the plan. Both Walk Bike Ohio, but more, I think specifically the SHSP directly addresses the ORC and some needs around not just speed, but also clarifying the rights and of pedestrians and bicyclists within the right-of-way and cleaning up some ambiguity there as well. Kate, I don't know if there's anything you'd like to add to that.
Yeah, no, I think you covered it really well. The Strategic Highway Safety Plan does include a speed-related emphasis area because we know speed is so important from the safety perspective. So that's definitely capturing some actions related to, some of the speed zoning process, some of those processes which, ODOT has the ability to look at and revise is something that's being captured within the Strategic Highway Safety Plan. So I think these conversations are definitely ongoing and super relevant. Scott, you're muted, I think.
Thank you. So this next question is for Carrie. Carrie, I'm not sure if you're still with us. And it has to do with sort of Licking County. Does Licking County have a mobility manager? And did the Park District there in Licking County, were they a participant on your active transportation plan?
Those are good questions. So we do not have a mobility manager here in the county. That may be something that we look into in the future. So the whole public transportation issue has been worked on, but kind of separate from what we've been working on this year with the active transportation piece. And so at some point, we're going to need to bring those together, working on our walking and biking networks along with this transportation network that I know that they're hoping to see come to fruition. Last year, all I know is that they hired a consultant to kind of do an assessment on where we would need public transportation and kind of what a fixed route would look like. But I'm not sure what next steps have been established for that specific piece. And then the Park District is definitely involved. And I think that was something I forgot to mention in my presentation, but we work really closely with them. They've worked on the multi-use trail project that we worked on last year. We shared our ATP plans with him already. He's very supportive and will be involved going forward for sure.
Great. All right. Thank you. So keep it moving around. So the next question is for Kate. And the question is, what's the best way to communicate dangerous locations that are heavily used by bikers? So how can we kind of put bikers on notice, hey, there's an intersection or a location here that maybe isn't as safe as other locations? Is there a way that we can do that, communicate back to the biking community?
Yeah, that's a good question. And I think my mind is first going more towards like a signage and engineering perspective, some of the warning signs that might be available for use. I think, that information is also helpful for us to be able to provide alternatives as possible, or to implement strategies that are going to help improve visibility and manage speeds as best as we can through those locations. I know visibility is really critical, especially as we look at some of the crash trends we see in Ohio, and things like lighting, like separated facilities are obviously going to be helpful to that. But also, I think the connection between speed and visibility can be helpful as well. So any sort of opportunities to alert drivers, increase awareness and visibility, slow speed so that we can better visualize those folks who tend to be traveling along the periphery could be helpful. And I can follow up with some other thoughts on that as well.
Yeah, so, and that's a great point there, Kate. So everyone who's posted a question in the chat pod, those questions will be given out to the speakers afterwards, and we'll try to follow up on each of those questions, even if we don't have the time to get to them all today. So next question is for Jordan again. And question, are there any specific regulations that you're aware of for electric assisted bicycles on trails or streets? Is there any sort of legislation that applies to them, or either at the state or local level?
It's a great question. There has been movement within the Ohio legislature related to further defining out electric vehicles and their ability to navigate on things like off-road trail systems and things along those lines. And I think that those bills are still working their way through. A lot of regions have taken this on quite well. We can look to places like Central Ohio and working with the metro parks and the city of Columbus, among other partners, to understand collectively what they would like to see on some of their systems, and working to ensure that there's a good understanding of vehicle classification, so different levels of electrification of and assistance of different vehicle types, and what is or isn't allowed on trail systems. So some good examples at the local and regional level within the state, and definitely movement at the state level to further refine that understanding and get some statewide coordination.
Okay, great, thank you. Okay, next question. We're going to go back to Carrie again. Does Newark or Heath have a fixed route affordable transit system to help connect bikes and peds to your AT system? And is that something that, well, I guess the follow-up question then to that is also, does the transit vehicles there in Licking County, do they have bike carriers?
So we don't have any fixed route systems at all in Licking County yet. So basically, what we have is an on-demand service. So you call the Licking County Transit, you tell them you need picked up, Tuesday at 9 a.m. to go to the doctor. They schedule it, they come pick you up, you have to schedule your ride back, and that kind of thing. So we don't have any bus stops, we don't have any buses. The transit vehicles are more or less a van. So there aren't, there's not capability to put a bike on, or at least it's not been done yet. So again, just going back to the need that we have to bring in an actual public transportation system into the county to provide busing to get people to, other communities, to get people to work sites, and other, destinations that they need to get to, so that they can, have all the opportunities that someone with a vehicle has, or someone who lives in a walkable community has. So right now we don't really have anything. So it's really important that we, we have some things that are, outdated, but this is important to start building these guides into new plans so that we can start making these considerations and hopefully, move on to better things in the future for Licking County.
Great. Okay. Thank you. Well, we'll take one more question. This will be the last question, and it is for Kate. And do you know if there are any requirements or I don't think legislation, but requirements for reflectivity, rider reflectivity? I guess in the EU they have some of those things. If you're going to be on the road, you have to have some sort of reflective material on you. Any requirements like that you're aware of in Ohio?
I believe the only requirements are related to bike lights at night. Something I'd follow up on, but I believe there's requirements related to having a front light and at least a back reflective plate on your bike to improve visibility at night.
Okay, great. Thank you. Well, to all the speakers, Jordan, Sarah, Carrie, Kate, thank you so much for making time today to present to us. Really appreciate your time and wisdom that you shared. With that, we've hit 11:30. And so at this point, I will turn it back over to Paula. Paula, any closing words for the attendees today?
Just a quick follow-up. All of the questions that were posed into the questions pod will be followed up after the session is complete. I want to thank you so much for your time. Thank you, speakers. This was a great session, and I appreciate your time. Have a great day, everyone.
Thank you.
Thank you.
Thank
Be safe,
you.
everyone.